Hi dear viewers, I am Zishan Ahmed. Welcome to my YouTube channel Medical Core. Dear viewers, in this short tutorial we will explain what is Ascites, what Saag test stand for and does it mean, Saag value, importance of the Saag test, result interpretation of the Saag, and at the last we will discuss the causes of high and low ascites. So keep in touch till the end. Ascites is the abnormal buildup of the fluid in the peritoneal cavity. It mostly contains the protein, majorly the albumin, lipids, bile acids, and white blood cells. Saag stands for serum ascites albumin gradients. It is a blood test that used to find out the differences between the albumin level of the serum to albumin level of the acidic fluid. We can find out Saag by serum albumin concentration minus ascitic albumin concentrations. Saag value if greater than 1.1 mg per deciliter is considered high Saag. But if the value of the Saag test is less than 1.1 mg per deciliter, then it is considered a low Saag value. It's Saag test that tells us what occurring with the Starling forces between the acidic fluids and the serum. It shows whether the imbalance is due to the hydrostatic pressure imbalance or oncotic pressure imbalance. Now, how to interpret the Saag result? So, in case of the high Saag, it's mean the fluid is pushed out of the circulation, which causes the high albumin concentration in serum. It's mean that high Saag value suggests that there is hydrostatic pressure imbalance. And in case of the low Saag value, that suggests that peritoneal membrane is more permeable to albumin, which allowing albumin to push out into the peritoneal cavity. Lower the serum albumin concentrations and it also tells us it is due to the oncotic pressure imbalance. Now, the causes of the high ascites include some major causes. These are the portal hypertensions, which may be due to the cirrhosis, heart failure, and portal vein thrombosis. The causes of the low ascites include infection like TB, pancreatitis, nephrotic syndrome, etc. Thanks for watching. Do subscribe, like, and share the video.